Dr.
Simar, thank you all. I would again share with you another interesting case of FEVR. You see, this was a baby with prematurity, but the profile was not conducive of a retinopathy that requires laser. So somewhere this is the child was bought at a chronological age of 5.5 months, lasered elsewhere for FEVR at 1 month of age, and this was the diagnosis. This is the left eye, and left eye was doing well, regressing fibrovascular proliferation. The right eye had a, as we can see, the disc drag narrowing of the blood vessels and fibrovascular proliferation at the zone 1 and zone 2, and an RD which was progressing during the follow-up. There is a progressive RD this side and this side also, with few exudates there. Interestingly, why the mother looked familiar to me. So when I looked at it, I thought the baby was advised for surgery. So laser was done at Bangalore, then they went to Delhi, but surgery they didn't do. They came to me again. So when I looked at it, I found out that a few months ago I saw her with a baby elder sibling who had both, who was blind from the birth and had retinal fold both the eyes, and this was the profile of the baby and the picture. You can see that the retinal fold in both the eyes, and I suspected it as a case of FEVR, and but the parents were unremarkable. With the fundus finding alone, they denied the fluorescein angiogram, and there was no consanguinity. I suggested, and interestingly, that time the mother was pregnant for 7 months. So I asked for a genetic testing of the child, and also counseling with the obstetrician for a probable possible early delivery, or at least fundus examination at birth. But she forgot that, didn't do that. She came, presented after 1 month, and after 1 month the laser was done outside, and this was the detachment. As we can see here, there was a retinal fold, the fibrovascular proliferation over the ridge, and the ridge was curling inside, indicating that there is a with the taut posterior highlight bridging between disc and this one, indicating that the ridge is going to override over the disc, and at the summit there was a vitreous condensation and anteroposterior traction, and so as surgery was done to address this 25 gauge vitrectomy. My primary aim was to address that anteroposterior traction. There was a from the summit, we dissected that, and followed by the highlight which was bridging between the ridge and the optic disc, and followed by from the ridge to the lateral one. I am a little bit conservative when while dealing cases where the retina is mobile, so that's why I was not that aggressive in peeling the vitreous over a mobile retina. And mobile retina can break off, and your outcome can change like anything. So then also the tractional vector between the optic disc up to the vertical limb of the T, probably proliferation along the highlight, that also need to be carefully dissected out from these membranes. That's what we did, and I will just quickly go to the outcome. You can see that the detachment slowly, the prolif regressed, and detachment slowly regressing, and this is the final follow-up, and the exudate and the tractional detachment subsided with a myopic refraction. Thank you so much.
Thank you.
Yeah, yes, it was in June 1. So this picture is not showing. Laser has been done all around. Laser was well done. That was an advantage for me.